the partnership, which is going to be starting about a project that got started, and how it's being used, which is really a 5-year plan in order to improve the health and well-being in the city of Alexandria. So the first thing is the partnership is a broad community coalition of individuals and groups and businesses. As you can see right here, the city, for instance, has a number of boards and commissions dealing everywhere from the Commission on Women to disabilities to housing to the budget. There's like 125 boards and commissions we have in the city, as well as with city agencies and healthcare organizations, et cetera. So we actually were formed in 2006 after a community health assessment was done during that time period, and several health issues were identified, and then it was determined that there needed to be a group to help facilitate addressing those issues over the years. So we have been around since 2006, so for the last 16 years now, and I've had the pleasure of, for the last couple of years of leading the partnership. And as you see, we have a website, we have a Twitter page, so hopefully you will go visit our website sometime. Before we get into the Community Health Improvement Plan, which will really focus our discussion today, we have to step back about how did we start. As I mentioned, in 2006, the partnership was formed because there was a community health assessment done during that time period. There was a community health assessment done in 2018 into 2019 to really look to see how was the health in the city of Alexandria. And this community health assessment is really set up and is fairly standard throughout all the health departments who decide to do these things. It was led by the health department, who was one of our major partners. And as you can see, we went through a series of sessions that went with a kickoff in 2018, as well as introducing our community members to data collection and then getting them involved in data gathering and examining results until in June of 2019, the Community Health Assessment Report was issued. There's a couple of things here. So this steering committee, which is different from the partnership steering committee, was created by the health department. I actually sat on that steering committee as well, along with representatives from our public housing agency and organization to our local coalition of Hispanic nonprofits in the city of Alexandria, as well as the the hospital and health insurance companies in the city of Alexandria. Really kind of a much more reflection of what we have in the steering committee for the partnership, but some different members. Including, we have the Medical Reserve Corps, which is a group of volunteers that help promote the health department and do a lot of their activities there. They really came to fruition during the pandemic when they went out to the neighborhoods to promote immunization and try to encourage people to take the vaccinations and inform them where they were and to try to answer all their questions. And the data collection, the data collection really centered around both qualitative and quantitative data. There were a number of surveys that were done to really focus on community threats and strengths that were done both online and in person. As a matter of fact, the health department went out and did 26 pop-up events throughout the city where they asked people to stop them in the streets and ask them to get information about health, but also to fill out a short survey. And all these surveys were done, they had capabilities of being done in English, Spanish, Amharic, Arabic, and Farsi, which are the major languages spoken in Alexandria. And then we did another slightly different thing, which was a thing called Photo Voice, where the community members were actually invited to go out and take pictures in the community of things that they thought were things that really promoted health in the city of Alexandria, and things that might not promote health, or things that they would like to see here that would promote health. And actually out of that, there were slightly over 70 photos that were submitted, and they were grouped in different categories, what those photos centered on, whether it was green space or gardening or health facilities, etc. So all this data over this time period was, community had these opportunities to vote on the data, to talk about the data, to provide their input about what they thought were important through that process. We looked at the data. We were able to oftentimes drill down the data into zip codes in the city of Alexandria. As we found, there were some zip codes. Actually, we know now that some of the zip codes, depending on where you live, you could have 5 years more of life expectancy than another zip code. And keep in mind that Alexandria is only 15.8 square miles. So that means just living across the street in a different zip code can have a major impact on your life. So all this was discussed during this time period. And then finally, as a result of that, it was identified, these are the 10 top health issues identified in the city of Alexandria. Now, as you can see, yeah, you say, oh yeah, I can see a lot of these folk are really, I understand how they're health issues. And some of these, such as neighborhood and built environment, economic sustainability, and primarily, as well as some others, don't really often fall into things that people think about at times when they think about health. But what are now determined in the field is to be social determinants of health, and it can actually have a greater impact on people's physical and mental health than actual seeing a doctor. So these were the top 10 issues. And from this, so these were reported out in June of 2019, and people were then informed that we were going to start the development of the Community Health Improvement Plan in the fall. We wanted people to participate. So the Community Health Improvement Plan. As you can see, it's data-driven, it's community-centered, it has strategies to develop programs, advocacy, services, awareness, education. The important thing is it lists the priorities of what the community think are important to be addressed over the next several years. This plan is a 5-year plan. We call it the Alexandria Community Health Improvement Plan 2025, which means that this plan will run through 2025 and is broken up to identify when certain tactics will start and when they will end during that time period. And then we've been able to use this to actually advocate for a number of things in the community. But there's three major sections here. First one is community. This is community developed and is community implemented. It focuses on health and it's a plan, so it's really a roadmap where we go over the next several years. And I will say, so the Partnership for Health of Alexandria has a steering committee, which is like its governing board, which, as I mentioned, is made up of the representatives as we talked about before. But they're not implementing the plan. They are facilitating. So we have, and I'll get into a little bit later, but we have owners for these tactics who are community members, community organizations, community groups. The steering committee just gets updates to see how things are going and to see if there's any barriers. And if there are barriers, the steering committee is supposed to sit there and try to figure out how to eliminate these barriers to help facilitate the work of the tactic owners. Some of the tactic owners, we just did the initial round of checking up on status, and some of the tactic owners were a little concerned, like, well, are you checking to see how well we're doing? And we're like, no, we're here to help. We really want, if you're struggling, let us know how we can help, who we can go talk to, what we can change. And if you're not doing well, we just want to know so we can report out to the community. So this was our development process. As I mentioned, so the assessment was done in June. In October 2019, we brought together community members and asked them to look at the 10 issues and to identify those that they thought were most important. And when they did, and it was really interesting because I know before then people were saying, well, Alan, what do you think are going to be the selected issues? And I said, I don't know. I only have 3 votes, like everybody else in the community. But I was thrilled when the community really went down and went to health, housing, and poverty as the 3 priority areas for the Community Health Improvement Plan, which means they really focus on those social determinants of health. That if people have more stable and better and safe housing, they're going to be healthier. If they're not dealing with poverty, if they have good jobs, if they have good employment, if they have access to education, And if they have access, as we know during the pandemic, if they have access to the internet and how to use the internet, they're going to be a lot healthier as they move through. So we did this, and we went through the root, and they selected the issues, and then we talked about root causes, and I'll get into the root causes and how we got there in a moment. And then, as you can see, in November, we came back and we started talking about these 3 priority areas. And the most important thing was we formed community work groups. So community work groups were formed around each of the 3 priority areas. And those work groups continued throughout the entire process to help do things. And as you can see, solutions were starting to be identified for the root causes. And then in January of 2020, the work group scored the solutions. And then it was important to make sure we had owners attached to each of the strategies that were identified. Because if we didn't have somebody to implement the strategy, there was no sense having in the plan and having people frustrated that it's like in the plan, but nobody's working on it. Nothing's moving forward. And then, as all of you know, in March of 2020, COVID hit. Things shut down. There were no more meetings, and people started looking around saying, what do we do? Luckily, I and a couple other people were used to Zoom by doing some other things. And I actually went out and got my own Zoom account, and the steering committee started meeting in April. The health department wasn't involved with us as much during that time period because they were focused on other issues such as the pandemic and what to do with it. But the steering committee started right back up in April, started saying, okay, what are we going to do? Where are we going to do? What are we going to do with this plan? And we started looking at the plan and started thinking about what is COVID telling us during this process, and how far are we going to go, and when do we come out of it, and when do we start engaging people some more? And as you can see, all that took place over those months. And then in June of last year, we implemented we publicized the plan, we released it, and we started. So this is just one of the pictures that we had from the from our community meeting in October, when they actually came together. We had about 90 people who showed up and broke out into small groups so they could actually sit there and think about which were the priorities that they wanted to select. And as I mentioned, they selected the 3. And then we started getting into what are the sub priorities and how do we get down to that. Actually, I'm sorry, I missed one slide here. I jumped over this. As I said, these were all the groups that were involved. I want to say, I noticed this morning, I left off one important group, and that was youth. We did involve a number of youth in our process because we wanted to make sure that youth had a voice and we could hear what they thought were important to change. They participated in some of the photo voice activities, as well as some of the meetings, particularly, for instance, that October meeting. There were many youth in there. At the same time, our community was revising its children and youth community plan. So they were starting their strategic planning process, and they were meeting with youth. So we agreed to exchange information based upon our meeting groups, so we could actually utilize what they were picking up that might influence our plan, and what we're picking up that might influence their plan. So that was a wonderful exchange of information. It really expanded our scope. And I will also add, the school system at the same time was starting their own strategic planning process. So they were community members, and we were exchanging information as well. So just as a side note, we decided, since all 3 of us were working together, we created a unified planning group so we can exchange all the information. And as of and now that we all have our 3 plans out, we actually have a unified implementation team that meets on a monthly basis to see where we're going and to see how we can collaborate even more. So that's just a side note to get into there. So what they started doing was under each of the priority areas, that they started talking about what are the most important sub-elements to do. And this is a multi-voting area. So as you can see, overall poverty got selected underneath economic stability. Under neighborhood and built environment, affordable housing. Oops. And under mental health, it became poor mental health. So these were the subcategories that was going to help drive those 3 priority areas. So poor mental health, affordable housing, and overall poverty. So that's how they became the 3 priority groups that were priority areas we're going to focus on. But once we got down to that, then we started asking the people, what are the causes? What are the root causes for these? And I'm going to tell you, we actually hired a facilitator to help us set up this meeting. And between the health department and myself and several members of the steering committee, we actually spent many hours preparing for this one meeting because we knew it was going to be central. So we talked about how to vote. We talked about providing everybody with information up front about the data so they can make wise choices. And then we talked about, so how do we get down to some of the root causes? And this was when I actually maybe many of you know about this, but this was my first time to try this technique, was called the 5 whys, which was you had with the tables, we had trained facilitators from the community. We trained them on how to do this, that would lead the conversations with their tables to asking why. So when people started talking about, well, the root cause of not having enough affordable housing in the city is X, the next question is, well, why is it X? And when somebody says, well, it's because this, and it's like, well, why is it this? And you go through this with the philosophy being that by the time you get to through asking that question 5 times, you basically are pretty much down to the root cause. And that's what we had everybody do. And as you can see, for housing, affordable housing, people started putting in about, not enough buildings, too costly, income's not high enough. Zoning policies impact the property that's available. When you get to mental health, they did the same thing. It was about the stigma, about stress, inequalities in the structures of mental health. People who provide mental health not looking like people who were going there. So if you were Black or African American, or if you were Hispanic, you would feel much more comfortable talking to someone who was Black or African American or Hispanic than someone who was white. And that was something that came out. And then in poverty, it came down to education, training, wages, and a host of a number of issues, but primarily training and education and access to opportunities all came out to those categories. So we did all that. We developed these strategies. The work group started meeting, talking about strategies, and then they started thinking about, so if we have these strategies, how good are these strategies, and what should we do with the strategies? 1 second, please. Just trying to catch up with myself here. Started talking about the strategies, and what we wanted to do next was to see, how do these strategies line up, and are there tactics that relate to these strategies that we can exist? Are these strategies and tactics, are they promising practices? Are they practices that have been used in other communities? Or are they evidence-based practices? And how do we know that? So we actually asked community members to find an area that they were interested in doing some research and do some more research about this. So between January and the end of February, they went around and we asked people to go on Google or any other search instrument you had, to look at peer-reviewed articles, look at newspaper articles, and try to identify actions, tactics, strategies that we might want to consider in the city of Alexandria. And actually, when we created the health department created this research portal where everybody could put in information into the portal. And they would talk about what was the tactic, or what was the action item there. What was the source? If it was an article, whatever, who were the authors? give a link to that and what was a really primary thing that came out of that. On February 25th, everybody came together, started talking about that, and started talking about which ones seemed to apply. But at that time period too, once we got to February 25th, we started talking about, okay, but what will work in the city of Alexandria out of these that we select? So we then started asking people to identify, do you think that this strategy or this tactic that matches up to the values and interests in the city of Alexandria? And we asked people to rate yes, or yes, they will, no, they won't, I don't know, or it might. And we started scoring all of those. The second question we also asked is, do you think this community would support this strategy or tactic? So that was another interesting, and with the same categories. So we were able to start narrowing down the strategies a lot by doing that. Just to show you, we started with almost 60 strategies for the 3 priority areas. And we started with the 60 strategies, and we ended up at the final end with 21. With 21 strategies. And just tell you now that we ended up with 3 priority areas, 21 strategies, and 80 tactics, which is actually a manageable plan. We did do another community health improvement plan 5 years ago, and we ended up with 8 areas and somewhere about 120 tactics, and we found it to be a burden, hard to manage, and there were areas that just fell off. And so that's why we went through this process. And it's really interesting because this research portal, I know and a couple other people, as we've moved on to do other things, we refer back to it to see if there's something in there that we didn't use then but may be applicable now. And I know some of the nonprofits were able to use it when they actually applied for some grants too. So this became a really interesting process. And it's also a good document for us. So the final stages for development. Between January and March of 2021. So we went through, 2020, trying to figure out what was going on. In October and November of 2020, we were able to get back work groups. Things had kind of gone down a little bit in the pandemic. People were more used to using Zoom, so we started using Zoom to have specific meetings. We had one meeting that focused on mental health, one focused on poverty, and one focused on housing. But during that time period, just before that, during that time period, we took a different frame. Given what we knew from the pandemic about working with community members, with problems that they faced, given what we knew based upon economic insecurity that struck during that time period, and given what we knew on the racial unrest in the city, in the country, and even in the city, if we put that lens on, were there changes that needed to be made to the plan? Do we need to add something? Do we need to delete something? Do we need to think? I will tell you that with the initial plan before the pandemic came about, nobody talked about digital equity in the plan. Nobody in the community, in any discussion, the community wasn't talking about it because of the pandemic, because the schools and go online after a while, trying to set up and everything else. Digital equity became a big portion of the plan. And it wasn't just for the students. It was for people who are job hunting, people who are trying to do job training. If they didn't have access to the internet, they weren't getting it. And then even for social connectiveness, if people didn't know how to, even if they had access, they might not have the equipment, or if they had access and had the equipment, may not know how to use the internet, certain portions of it. So all that became an element in the community health improvement plan. Criminal disparities in the criminal justice system became another area that grew out of the pandemics of social and racial unrest that occurred, as well as we recognize the need for greater services. So for instance, there's an area now in the plan to provide wraparound services at the Northern Virginia, at the community college here in the city of Alexandria, the campus that they have here, to help students who might be struggling emotionally or economically or academically. So that work is going on as well. So we did all that. We added some things, and then between January and March of 2021, we started asking boards and commissions to identify other tactic owners in the community and to make sure that there were owners for everyone. Because as I mentioned, we did not have an owner. We weren't going forward with that tactic because it would be useless. We were actually able to, through this process, identify people who we'd never thought about before in the community. And we have brought together multiple owners in some areas. And in one area, we actually brought together a local university that doesn't have a campus in the city of Alexandria, but provides emotional support and training for their graduate students in psychology, who was working with some of the other communities, but wasn't working in the city of Alexandria. So we brought them into this process to help out in the expanding mental health services. So this really helped us identify new members. And then we had a couple of drafts during that time period and started asking people, showing little bits and pieces of it. And then in April to May, we did this thing where we sent out a complete draft to everybody and asked them to do a fatal flaw review. And this is a technique I learned at GAL when we were doing our reports. When we got down to, we felt we had a lot of people's input. We felt we were pretty good where we were with our report. We sent out to everybody and said, okay, do a fatal flaw, which meant if this report or this plan goes out this way, is there anything missing or that should be restated that if it went out, it would be a fatal flaw in this plan? And we actually had a few people come back and say, yeah, you skipped this or you skipped that. And so we reworked it. We had conversations with those individuals, and we sent out another draft, did one more fatal flaw review. That time we were fine. Everybody was great with it. So then as I mentioned, in June of 2021, we issued our plan. City Council, the Alexandria City Council did monitor the process throughout. City Council members actually participated in many of the conversations. And then in September 2021, I and the health department presented the plan to the City Council, at which point they asked several questions and they endorsed the plan. And here's just real quickly to show you the structure of the plan. As you can see in each of the areas for the strategies, we have the strategies, and then we talked about the tactics. We talked about timing. We have process measures, and then we list who the owners are. So we do this for housing, as you can see, and these are just two of the tactics in this area. This is for the mental health area, and we keep the same format throughout, and then this is for poverty. And just so you know, for each of the priority areas, we have 3 or 4 overall outcome measures that we hope to achieve over the next 5 years in the city of Alexandria. And then, so what does it really mean now? So everybody's working. We are now in the process of seeing where things are going. We've had several of the tactic owners come to the steering committee to present, talk about what their issues are and how well they're doing. I'm sure many of you know about the American Rescue Plan, the dollars that went down to communities. The City Council had 3 public hearings and community meetings to ask about where should the dollars go. The partnership was able to present to City Council areas in the Community Health Improvement Plan that they thought funding would be really helpful to move forward. The important thing was the partnership wasn't asking for any money for itself. The partnership was asking for money for others. We were asking for money, for instance, to do a study in affordable housing, or to add more money to affordable housing, or to provide money to nonprofits, general nonprofits, to expand mental health, or to expand the mental health professionals in the school system. So that was really important, and it really carried a lot of weight for City Council, because we were not asking for the money. And the nice thing was City Council actually funded a number. We came in with 10 major requests, and they funded 8 for 8 tactics out of 10. So that was 80% was pretty nice.
Alan, just to jump in on while you're talking about it, we had a question coming in the chat, and we'll thank you for the questions. We'll typically save them for the Q&A, but the question was, could you just refresh the group's memory on an example of like those tactics that got funded? So just so folks have it top of mind.
Sure. Well, one of them was for the digital equity area. We asked that they create a digital equity plan and actually hire a digital equity coordinator to implement that plan. And that was one of the ones that they actually funded. They also allocated some funding to affordable housing. They also allocated funding to eviction prevention. And eviction prevention was an element underneath the housing area. And so those were 3 that came that City Council decided to fund with the American Rescue Plan dollars. The important thing, though, we didn't stop there, because all governments, they do an annual budget, and when they did their annual budget, when in the City of Alexandria, when they get near the budget, and they have this add and delete list that they put together, and which is usually done about 6 weeks before they decide the budget, and it's what council members add to the budget or propose deleting to the budget, and then they have a public hearing. And I was able to go in and say, look, for those items, one dealt with affordable housing, just to show an example, relate to the community health improvement plan. So if you fund that, if you fund expanding, provide funding to certain affordable housing projects, you will help advance the community health improvement plan. I had the mayor and several city council members shoot me an email afterwards and going, this is great. You were able to point to what the community said was important, and you could identify specific tactics in the plan that it would go to. And actually, it allowed them to say, oh yeah, we're going to fund those. It gave them added support to do that. The other thing that the partnership, now recognize, we're a broad community coalition, so we're supported by a bunch of groups, but we're a standalone group. Through the community foundation in the city, we created a donation account. So they handle so they're the 501c3 fiscal agent for us. But we actually fundraise, and we raise money. And last year, so remember, we issued the plan in June, and actually in September of 2021, we awarded our first 2 grants. I recognize we got small amounts of money, but we awarded 2 grants, each for $10,000, and they focused on addressing mental health tactics. This year, our second cycle, which we just awarded last week, we awarded 4 grants. And what the group decided to do, the steering committee really wanted to do, was make sure that funding went to, that grants went to at least 1 in each of the priority areas as a minimum. So we had 3 priority areas, we had 3 grants, and then we had another grant that came up very high, which we awarded. So we actually did 2 in the poverty area. And that second one really dealt with promoting minority businesses in the city of Alexandria, particularly during Minority Business Month in August, as well as promoting throughout the year people going to minority businesses and serving as customers in minority businesses. We're excited. This has been a year and a half. We got several more years. And then what happens after this? It's a 5-year plan. The intent is that about a year and a half out, we're going to start the next community needs assessment, community health assessment, and then we're going to start this cycle again. So whatever doesn't get done during this time period, we'll move forward. One of the other things I do want to highlight, just because I always love this, and I didn't mention this before, just as our plan was released publicly, we already had something that was implemented because of the American Rescue Plan, which was we had what we wanted: free bus transportation in our city bus system, where anybody could ride the bus for free, because that would provide access to everywhere. And actually, through the American Rescue Plan, they were able to fund a year and a half, and then they applied for another grant to go for 2 years after that. So we've already had free bus transportation in the city of Alexandria for actually a year and 2 months now. So that's been the process. The most important thing, though, is the partnership. The steering committee just focuses about where's everybody going, where do they need help, where don't they need help, stand back and not get in their way, and advocate with city council for funding for where it's needed. And then but the community is implementing it. And it's working really great. They feel a commitment to it, and it really goes a long way with the elected officials. And with that, thank you.
Alan, thank you so much. And feel free to pull down your slides, so if we can have more of a engaged conversation. I'm going to go ahead and turn off the recording just so